Welcome to The Explainer. Today, we're going to talk about one of the most common and most misunderstood signals our body sends, a fever. We're going to decode what that rising temperature is really trying to tell you. You know the feeling, right? You're hot, but you've got the chills, you're tired. We've all been there. That rising temperature is a universal sign that something's up. But here's the thing. It's not just random noise. It's a very specific message. So let's dive in and figure out what our bodies are actually saying. So first things first, we've got to reframe how we think about a fever. It's not the illness itself. Think of it more like the body's alarm system, a totally deliberate and controlled response to some kind of threat. And this is the crucial point. A fever, or pyrexia, if you want to get technical, is not your body failing. It's the exact opposite. Your brain's own thermostat, a little area called the hypothalamus, is the one intentionally cranking up the heat. Why? It's a defense mechanism designed to make your body a really awful place for invaders like viruses and bacteria to hang out. Okay, now this is where the real detective work starts. When a doctor is looking at a fever, you might think the most important clue is how high the temperature gets, right? Nope. The single most important clue is how long that fever has been sticking around. And that one factor, duration, sends them down two completely different investigative paths. And this slide lays it out perfectly. On one side, you've got the acute fever. Let's call that the sprint. It's a fast, intense response that's usually all over in less than a week. But on the other side, you've got the chronic fever, which is more like the marathon. This is a fever that drags on for more than 3 weeks, and it goes from being a common symptom to a real diagnostic puzzle. All right, let's start with the sprint. When we're talking about an acute fever, one that lasts less than a week, doctors are basically looking for a very familiar lineup of culprits. This is by far the most common situation. And here they are, the usual suspects. The huge majority of the time, a short-term fever is caused by a simple viral or bacterial infection. You know, the common colds, the flu, strep throat, that kind of thing. It could also just be your body's inflammatory response to an injury, or maybe a gout flare-up. Basically, these are threats your body is really well equipped to deal with. So for a short-term fever, the message from your body is pretty clear. It's saying, hey, I found a problem, I'm fighting it, and I've got this. It's actually a sign of a healthy immune system doing its job, and usually the whole case just solves itself. But what happens when we go down the other path? What if that fever crosses the 3-week line? Well, now the entire game changes. The simple sprint has turned into a marathon. This isn't a straightforward case anymore. It's a full-blown medical mystery that needs a real detective hunt. And in the medical world, this has a specific name. Fever of unknown origin, or FUO for short. The definition is really precise. It's a fever over 101 degrees Fahrenheit. It lasts for more than 3 weeks, and it stumped doctors even after all the initial tests. This is basically the starting pistol for a much, much deeper investigation. So when investigators are looking at an FUO, how do they narrow down the culprits? Well, they've got what they call the big 4 suspects. As you can see, hidden infections are still the #1 cause. But right behind that are inflammatory diseases, then cancers, and finally this really interesting catch-all group called miscellaneous. Let's break down each of these suspects. Okay, suspect #1, hidden infections. We're not talking about a simple cold here. These are things like a colt or hidden abscesses, maybe deep in the liver or even from a tooth. Or it could be something serious like endocarditis, which is an infection on a heart valve. These infections can just smolder inside the body, causing a persistent fever without many other clues. Suspect #2 is when the body's own immune system is actually the source of the problem. These are non-infectious inflammatory diseases. We're talking about conditions where the immune system gets confused and starts attacking healthy tissue, which, you guessed it, causes a long-lasting fever. The third category, and this accounts for up to 20% of these mystery cases, is malignancy. Certain cancers, especially blood cancers like lymphoma and leukemia, are kind of notorious for showing up with fever, night sweats, and weight loss. The fever is basically the body's reaction to the cancer cells themselves. And last but not least, we've got the miscellaneous bucket. This group has a fascinating and surprisingly common cause, drug fever. It's wild, but almost any medication can trigger a fever as a side effect, sometimes weeks after you even start taking it. This category also includes things like blood clots and other rare causes. So with all these possibilities, how do doctors actually solve the case? They follow a very systematic, step-by-step hunt. It all starts with questions, a deep dive into your story, where you've traveled, your hobbies, your medications. Then they scan for clues with blood work and imaging like CT scans. But often, to get that final decisive piece of evidence, they have to get a piece of tissue, a biopsy. Because, as they say in medicine, tissue is the issue. Okay, so we've run through the sprint of a normal fever and the marathon of a medical mystery. So, what is the single most important thing to take away from all of this? A lot of us tend to worry when we see a high number on the thermometer. But for a doctor, a high fever of, say, 104 that only lasts for 2 days is often way less concerning than a persistent low-grade fever of 100.5. And that's because the most important clue isn't how high the fever is. It's how long it's been there. Time. That's the one thing that transforms a common, everyday symptom into a complex diagnostic mystery. It's the key that unlocks the whole investigation. And this quote just sums it all up perfectly. A persistent fever is the trigger. It's why doctors ask all those questions about your pets, or your travels, or your job. They aren't just being nosy. Each question is a potential clue in a high-stakes detective story where your body is providing all the evidence. So the next time your temperature starts to climb, just remember your body is trying to communicate with you. Most of the time, it's a short, clear message. But sometimes it's the start of a much longer story. And the real question is, are you listening to the signals?